So welcome back to part 2 of aromatherapy presentation. So what are some benefits of aromatherapy? So some physical benefits of aromatherapy is almost all essential oils have antiseptic properties, are able to fight infection, destroy bacteria, fungi, yeast, parasites, and or viruses. So it has that type of property. Many essential oils are also reduce aches, pains, soothes, or root inflammations and spasms. It also stimulates the immune system of insulin and hormone production, so that's good for people who struggle with diabetes. Affects blood circulation, so that helps with people with hypertension. Dissolves mucus in open nasal passages, so that's good if you're having like those seasonal allergies or recovering from a cold. So that helps with that. And aids in your digestive system. So some more benefits. So it decreases nausea. Also is good for pain and body aches. Helps fatigue and insomnia. So I know like lavender is a good one if you are having trouble sleeping. That's a good one for relaxation and sleep. Muscular aches, headaches, circulatory problems for women who have like menstrual problems, it also helps with that. Also, women who are going through menopause too, it helps. For alopecia or hair loss, some types of psoriasis, although you kind of have to be careful because sometimes people with sensitive skin, it could cause a reaction. Also, it's good for toothache and mouth sores. It can be relieved by clove oil. So there's many physical benefits. There's also emotional benefits too for aromatherapy. So aromatherapy can also have considerable influence on our emotions. So sniffing sage, for example, can quell panic attacks or panic, while the fragrance released by peeling an orange can make you feel more optimistic. Some essential oils also help with anxiety, agitation, stress, or depression. So as anything, there's also some benefits, but there are also some risks when starting like aromatherapy or any type of therapy. So always, if you're putting anything on your skin or in your body, make sure you always talk to your doctor before using any aromatherapy. Since essential oils causes reaction in the body, not all oils will benefit everyone. So like, for example, like I'm allergic to eucalyptus, so I probably should not be putting eucalyptus on my skin or inhaling it because it caused me to have an allergic reaction. So that's like an example of something. Chemical compounds in essential oils can produce adverse effects when combined with medications. So again, remember to talk to your doctor if you want to start this and talk about any medication and what possible side effects could be. They may reduce the effectiveness of conventional drugs, or they may make health conditions in individuals worse. So that's another thing to be careful for. So like, for example, a person with high blood pressure, for example, should avoid stimulants such as rosemary. Some components such as fennel, aniseed, and sage act similarly to estrogen. So if a person with the estrogen-dependent breast or ovarian tumor should avoid these. So again, just always talk to your doctor before you're starting a new treatment. Some other risk of aromatherapy. So some oils produce toxins which can cause damage to the liver, kidney, or nervous system, especially if taken internally. Swallowing essential oils can be hazardous and fatal in some cases, so really be careful. Do not ingest, like if it's supposed to go on the skin, do not ingest it. Individuals with any of the following conditions should, or even if you're putting in a diffuser too, you should also be careful to not ingest it. So here, I'll stop right there for now, and then we'll pick it up in part 3 of this presentation. So just stick with me.